My name is Mark Kingston. I'm from Swansea University Medical School. I'm delighted to present some exploratory work looking at the role of paramedics providing non-emergency care in care homes. This is an emerging area of workforce innovation, and the PERCH study represents a conscious effort to align research with these developments. The PERCH study is led by Dr. Lee Keane, a paramedic and clinical lead with the Welsh Ambulance Service. And together we've convened a research team comprising representatives of primary care, care homes, NHS health boards, alongside patient and resident representatives and academics. The quote displayed here is pretty much the starting point for the PERCH exploration work. It's a phrase that was quoted by a health board manager who was struggling to support the patients and residents of two failing general practices. They explained to me that it was challenging to meet the needs of care home residents. GPs often couldn't respond to visit requests from homes in a timely fashion, resulting in out of hours or even 999 calls. Yet at other times, GPs are bumping into each other in care homes with visits not coordinated and single care homes often linked to multiple practices. With ongoing difficulties in recruiting GPs, they were looking at alternative staffing arrangements to support care home residents. They hope to introduce advanced paramedics to provide primary care services across multiple care homes and multiple GP practices. This may include a regular ward-round approach, at times agreed with the care home, and being available at short notice to deal with emerging issues. So this was about improving care over and above what practices could currently provide, with a view to preventing admissions, providing continuity through regular scheduled contact, and reducing GP call-outs. Casting our net a little wider, we found that such initiatives were already operating around the UK. We identified a number of examples with different configurations and funding, but all placing advanced paramedics into care homes, outside of a standard emergency ambulance role. We found examples of community paramedics employed by ambulance services, supporting care homes and other community organisations. We found GP practices employing their own paramedics, particularly where there were a large number of residents to support. And we also found examples of care homes employing paramedics. Overall, this fits into the national picture of a major shift of paramedics from the emergency service into primary care. Indeed, NHS workforce data confirms up to 1,000 paramedics are working in primary care in England alone, with an 8-fold increase in the past 3 years. Now, research projects are underway looking at roles in general practice more widely, but not at care homes. And with around 420,000 UK care home residents, the care home sector is critically important and deserves its own focus, as the COVID-19 pandemic has reminded us. But clearly here, there are lots of questions to resolve about such emerging models of care. Are they safe? Is it cost effective? What are patient, resident and staff views? What happens to 999 calls, hospital conveyances and so on as a result? The initial aim of the PERCH study was to better understand the motivations or drivers, or rationale, for paramedics providing proactive or reactive care in care homes. Now, as researchers, we hope that this will in turn lead to a follow-on study taking a closer look at evaluating or looking at the effectiveness of the new care models. But firstly, in exploring the rationale, we used 4 main approaches. A brief overview of the background literature. We also obtained and explored a dataset of 999 calls originating from a sample of care homes. Next, we undertook a short online survey of care home managers. And finally, we held a stakeholder workshop where we explored potential outcomes of a paramedic/care home intervention. In terms of the background context then, there's plenty of evidence of falling patient satisfaction in primary care, of increasing demand on GPs, and of issues with staff shortages. In response, we've seen high-profile policy interventions such as the NHS long-term plan. Now, this promises an extra 20,000 additional primary care staff in England, with more nurses, pharmacists, therapists, physician associates and of course paramedics. Meanwhile, there's a significant national policy focus on improving care for residents of care homes, as demonstrated again in the NHS long-term plan and through various enhanced services and frameworks that encourage amongst other things, more regular assessments, support and reviews of residents by general practice staff. Meanwhile, for ambulance services, care homes are a regular destination for emergency call-outs, with many of those call-outs resulting in hospitalisation. A recent Health Foundation report looking at emergency admissions from care homes provided insights. They followed 195,000 English care home residents for 1 year, based on 2016 and 2017 data. They found that on average, each resident went to A&E once, and emergency admissions 0.7 times per person per year. They also calculated that 41% of emergency admissions were for conditions that were potentially manageable, treatable or preventable outside of hospital, or could have been caused by poor care or neglect. Next, we looked at a 3-month sample of 999 call centre data, which corresponded to 66 care homes in one health board area. Care homes here were identified based on text and postcode fields. We examined incidents whereby an ambulance attended the scene, and what we found was that there were over 1,000 such cases over the 3-month period, with an average of 15 per care home. We also found that the highest monthly figure was 35 999 incidents in one 90-bed care home. We noted high conveyance rates here of 61%, relatively low treat at scene rates, around 11%, and that incidents out of hours were twice as high as in hours. Our next piece of work was to survey care home managers about the potential role of paramedics working proactively in care homes. We outlined the intervention planned in one area, i.e. an advanced paramedic providing regular scheduled and urgent visits to care homes and working closely with GP practices, pharmacists and the care home staff to help manage the health of residents. We sought views on such an initiative and the potential challenges and benefits. We distributed an online survey through the Enabling Research in Care Homes network, that's the Enrich network, in spring 2019, receiving 50 responses. A few indicative comments are provided here, and I'll give you a few moments to read those. Overall, then, to summarise the survey findings, we found a great deal of support for the proposed intervention. Essentially, respondents recognised that it may add some extra capacity, and they recognised that paramedics bring particular skills in dealing with vulnerable groups, in assessment and in decision making. Some comments emphasised that success may depend on paramedics' integration with other staff both in and outside of the homes, and in addition, working across multiple sites was recognised as potentially adding service complexity. The final aspect of work with the Perch Exploratory Study was to hold a stakeholder workshop. We held this in October 2019 with 25 stakeholders brought together from various organisational groups and individuals, including primary care, NHS, care homes, social care, patient and resident representatives and academics. The purpose of the group was to explore outcomes, particularly what factors might be influenced by the introduction of non-emergency paramedics into care homes, and be they intended or unintended consequences. The participants identified a host of potentially affected areas, all of which may need exploring in any subsequent evaluation work. These included measures at patient and resident, staff and organisational levels. Examples included emergency admission and 999 call rates, conveyance rates, the views and experience of residents and staff, the presence or absence of care plans, cost of the service, the impact on general practice targets and workload, would, for instance, GP capacity increase? Essentially, a whole host of things that might need to be considered in any further work. I will move on now to summarise the Perch study findings. Perhaps the most prescient point is the first here. Models of care involving non-emergency paramedics in care homes are already in place, and the direction of travel for allied health professionals across the whole of primary care is on a huge upwards trend. Primary drivers being GP shortages and recruitment issues, and recognition that there are opportunities to improve care for care home residents. In addition, we've illustrated high numbers and rates of conveyance and hospitalisation from care homes, with data indicating that many such instances may be preventable with earlier and improved support. Where models are in place or forthcoming, they may vary, e.g. by employing organisation or area of coverage, be it single or multiple sites. So this may be a complex intervention, but generally we believe there are consistent outcome measures that would apply in all cases. Although some studies are underway looking at primary care paramedics in general, they focus on the general practice activity rather than care homes. But the care home perspective is important and often neglected. We need to look at the effects of such new services, like we've identified in Perch, before they are introduced widely. The danger here is that policy and implementation are far ahead of the research understanding. In recognition, the Perch study team have prepared a follow-on feasibility study looking at the effectiveness of paramedics providing non-emergency care in care homes. We have submitted this to a national funder where it's currently under review. As we move ahead with this work, we would be delighted to hear from any interested parties, so please do get in touch using the email address on the following slide. Finally, thank you very much for listening. If you do have any comments, then please add them below the video and we will respond, or drop us an email with the details provided. Farewell.